Hi, and welcome to ECCB Connects. Are the region's healthcare systems equipped to deal with the existing health challenges and those to come? In this episode, we'll share with you excerpts from the recent ECCB Digital Dialogues on the topic Pandemic and Healthcare, which focus on critical issues affecting our region and what can be done to ensure our people have more affordable and equitable access to quality health care. Stay with us. We'll be right back after the break.
The Eastern Caribbean Central Bank is rolling out Dcash, the next step in the evolution of the EC dollar. Use Dcash to send and receive money to and from friends and family. Make payments directly from your smart device. Make payments from wherever you are. Download the app from the Google Play or Apple Store and sign up, or visit dcashec.com for more information. The future of the EC dollar is digital. Let's make history together.
Thanks for staying connected with us. The World Health Organization, WHO, declared COVID-19 as a pandemic in March 2020. To date, the pandemic has claimed 122 lives in the Eastern Caribbean Currency Union and 3.4 million worldwide. The April edition of the ECCB Digital Dialogues examined pandemic and healthcare. Governor of the ECCB, Timothy N.J. Antwine, moderated the session, and the panel comprised Dr. James Hospitalis, founder of Earth Medic and Earth Nurse Foundation, and former executive director of the Caribbean Public Health Agency, CARPHA. Dr. Carleen Radix, head of the Human and Social Division at the Organization of Eastern Caribbean States, OECS Commission. Dr. Damian Graves, professor at St. George's University and former Minister of Health in St. Lucia. The last major pandemic was the 1918 influenza, also known as the Spanish flu. Dr. James Hospitalis explains the occurrences of these pandemics and what can be expected in terms of the incidence of such global health threats.
There have been about 8 or so declared pandemics in the last 100 years, which is where a disease spreads widely throughout the world in many, many countries, beginning with the so-called Spanish flu in 1918-19 that probably started in an Arkansas pig farm. Then you had, then the 50s, the 60s, flu, Asian flu. In the 70s, remember we had HIV/AIDS, and that's not gone away. Not a pandemic, but in the 90s, we had cholera re-emerge in the Americas. And then in the 2000s, we've had SARS, which many people would remember, and MERS, and then swine flu in 2009, and now COVID. So we have a history of pandemics in the world. They seem to be getting maybe more frequent. In addition, for us in the Caribbean, WHO doesn't call them pandemics, but vector-borne diseases, dengue, chikungunya, Zika, which was called a public health emergency of international concern, the threat of Ebola. These are some of the epidemics that continue to be there. First of all, human-animal contact and the destruction of nature all over the world. That's how Zika entered some of the flus through pigs, and that is a big factor. Second is population growth and travel. We used to have 25 million international travelers per year in the 50s, and now it's over 1 billion international travel arrivals per year. The Caribbean participates in that through its program, tourism, both land and sea. But that's a factor in the rapid spread of diseases from one part of the world to the other. The third is climate change. The world is changing, climate's accelerating with more heat and destruction of nature. And the fourth is the actual population we have. We have an older population. We're older than we've ever been in the history of humankind. And many people are not well. They have non-communicable diseases, which make them vulnerable when an epidemic does come along. What can we expect? Well, I'm afraid it's not good news in some ways. We can expect more pandemics and epidemics. We can expect them to be more complex. By that I mean that the infectious disease problem gives rise to economic and security and other types of problems, as we are seeing with COVID. Um, we can expect more because of how the climate is changing. We have record heat, which makes mosquitoes breed faster for some of the epidemics that we suffer from. Wildfires that drive animals from their homes to people, floods, the hurricanes that we've had, which set you up for an epidemic afterwards, the biodiversity loss, which sometimes makes way for a pathogen to emerge. So all that points to, Tim, we can expect more pandemics and epidemics, more complex ones, and we need to be prepared and resilient in the light of that.
The COVID 19 pandemic posed a severe strain on health systems globally. Dr. Radix shares her views on the extent to which the region's healthcare systems were equipped to deal with the pandemic.
I don't think any health system in the world was prepared for this pandemic. Although, if you've been watching closely, based on what Dr. Hospitalis has said and things that we knew, we should have and could have been as a globe more prepared. But none of the health systems were prepared to deal with this pandemic. I think the advantage our health systems had in the region um, was first the fact that we were forewarned. The disease started on the other side of the world and it took its time to come to us. So we were able to see and learn from what was happening in other countries and to anticipate how it would come to us. Um, Another good thing about our system is that we have strong public health systems. We believe in prevention. We believe in nipping things in the bud. And so across the region, you found that early on, there were strict measures put in place to further delay the spread of the disease into the region. And I think we're seeing the long-term effects of that when we compare the rates within the region to what's happening globally. So one of the good things about being in small island states is that for most of us, coming in to by air, where you'd have quick transmission, there's one port, and so it's in terms of controlling borders. And if you're coming by sea, there's some time factor there, which has a protective effect. We also have very agile systems, being one of the most disaster-prone regions in the world, having to shift, and I think it's one of the reasons why we have such a strong public health system, having to shift to respond. Um, we have hurricanes. We know what's happening in St. Vincent right now with regards to the volcanic eruptions. Dr. Hospitalis spoke to vector-borne disease outbreaks. And so we consistently had to be agile and to shift. And I think with practice, we've been able to shift into gear to respond to this pandemic. And we've also been able to learn our health systems and in some way, and our health professionals are a melting pot of persons who've been trained from many different parts of the world and connections in different parts of the world. So managing the disease itself, or persons who've become ill and have been hospitalized, we benefit from the knowledge from many different systems to be able to manage disease. And I think that's borne out in the number of deaths compared to the number of reported cases within our region, which are a bit lower than the global average of a little over 2%. In the Caribbean region, it's around that, but especially in the Eastern Caribbean, it's a bit lower at about 1.4%. And then our public health strength is again shown in the vaccination effort. We have been able to vaccinate, at least within the Eastern Caribbean Union, close to 22% of the population on average, with going from about 10% to 40%, depending on the populations of the countries that we're talking about. And I think this is a great strength in terms of the way we're able to respond. So I think our health systems and the people within the health systems, I give my hats off. I think they've been doing quite a lot for quite a prolonged time in the fight against this pandemic.
It is often said that a nation's wealth is a nation's health. The current pandemic has called for a closer examination of the strength and resilience of our region's healthcare systems. As a long-standing advocate, Professor Graves outlines some of the improvements made over the last decade and areas of concern which require development.
I think we have seen the strides in terms of health systems, or those managing health systems understanding the importance of having other people on the table, around the table, making certain decisions. As Dr. Carleen Radix has suggested, we have seen a sound COVID-19 response strategy, and she has outlined the reasons for that, so I would not go into that. But we have also seen what you call the OECS Pharmaceutical Procurement Service and Supply Chain Management, which is a model to other areas of the world, and we have to say kudos for that. We have seen some strides in our maternal and child health situation. We have seen some strides in infectious disease control and management, undoubtedly. And of course, we have seen some amount of success in an understanding and appreciation of the social social determinants of health. We have also seen some strides in the institutionalization of monitoring and evaluation, but there is still some way to go with that. And of course, policies and plans in human resources for health, I think we are beginning to appreciate that that is important, and we're beginning to turn the corner, but there's still something that needs to be done. Now, what are the areas of concern? One of my biggest areas of concern, Governor, is public funding and investment. I believe that public funding and investment are insufficient in terms of the coverage of our population, and to really meet the goal of what I call the community health, population health, but also the individual health status in terms of individuals within the population. The average of 6% in terms of the budgets that our governments across the region configure or craft for year after year. I think we need to look more at that, because I am concerned that our out-of-pocket spending, the spending by the ordinary man and woman on the ground, there's an inordinate amount of spending on individual medical care and treatment of disease. And we have to look at that. That is a critical issue that we have to take into account. And also the fragmented investment and allocation to specific programs. And I believe that there's still too much being looked at in terms of secondary care, and our primary health program, although picking up in some form, I think we need to inject more funds there for the purpose of health promotion, health education, information gathering, and the like. I am concerned with the persistent, fragmented, disease-centered approach to service delivery. I think that, and I just mentioned primary health care, and also the management. And therefore, there's this focus on what I call curative care. And I think that we need to look at that in some form. Insufficient emphasis on the access on quality, on equity, on equality as well. The quality of care is important. How do we know that our patients are getting the care that they need and really getting the optimum care that they need? So there needs there's a need for a quality-driven culture with not just a patient-centered approach, but a person-centered approach, taking into account lifestyle issues, chronic diseases, and the whole gambit there, and not necessarily, as I said before, just a patient-driven approach. I believe that one of the biggest concerns for me would be the weak leadership management and governance structures that persist. And therefore, we're talking about promoting the governance of health in all policies, intersectoral collaboration, vital, whereby the leadership within the authority or within the ministry is an individual who facilitates that kind of partnership, and that is the new role. And so the triumvirate of the minister and the PS and the chief medical officer, in my humble opinion, is not working. The need for programs and policies to address prevention of non-communicable diseases and mental health. These need to be given priority on the health agenda. Instead, we see a biomedical disease model kind of approach being employed with an emphasis on clinical delivery of services, and to my mind, ignoring to our peril the social and other determinants of health. Finally, because there's a lot, the inadequate health force situation we have to look at, either from the point of view of the migration of our nurses, and of course that has been stymied a little bit by the recent COVID-19 pandemic. We're also talking about specialities. We're talking about specialist physicians, specialist consultant physicians, if you will, but also those social scientific areas that need to partner with health in order to tackle the determinants of health. And we're talking about your health planning, your health economists, your statisticians, and so on. The whole gambit to add to the research and the information against the backdrop of the essential public health functions, and of course, the whole framework of the health system now in terms of assessment, policy development, resource allocation, access. All of those issues need to be taken into account, as well as the social participation and social mobilization needed in terms of the social capital that we need to get, in terms of the responsible areas that need to be looked into.
The COVID-19 pandemic has brought into clear view the need to transform our region's healthcare systems. Dr. Hospitalis outlines the areas which should be given priority. These include continuing with prevention methods, addressing vaccine hesitancy, and focusing on commitments to universal health coverage and health security.
I think our number one priority, sir, is to pause and to learn from this situation and see how the COVID pandemic is actually part of a bigger picture of the unraveling of creation, if you will. And then to act, to invest in human and social development, and to invest in a healthier planet and environment, because those are the two building blocks of your healthy economy. And work better together among ourselves in the region than we have ever worked before. We like to grumble and complain. We don't know how to work together as well as we could, and we need to. And second, make more noise at global level than we ever made before. So that's my summation of the priority. Take the moment. Don't just think, oh, we're going to get over this and then back to business as usual. We will get over it. But if we go back to business as usual, we would have failed in what I think is the most important priority, to learn from this situation. And I'm speaking now with 30 years of experience and then reading and looking back over the previous couple of generations, because you asked me to start by looking at 100 years of pandemics. I guess the immediate priority is to get on top of this epidemic of COVID, continue with your prevention measures, with the vaccination programs, and getting those to levels where we achieve herd immunity. That's number one priority. Addressing vaccine hesitancy, which is playing at play. And that has to be, I'm getting my vaccine tomorrow. I have no hesitation in saying the vaccines are safe and effective. Of course, subject to whatever your local guidance would be. In terms of health broadly, not just these epidemics, but we have to focus on the commitments we've made with universal health coverage and on health security. We tend to ignore the public health functions. People clamor for the immediate things, the heart problems, the diabetes. Oh, and by the way, part of the recovering from COVID is to attend to the things that we've been neglecting. We perhaps attended to COVID, if you will, over as islands fairly well. I agree with Dr. Addix, but a lot of things got neglected. People with non-communicable diseases, also all sorts of problems, cancer that have been delayed. And so there's some treating with that needs to happen following people's health, people's travel, resumption of travel, resumption of job, all those are tied up. And they lend themselves as well to digital solutions. And here I would like to offer EarthMedic and some of our digital partners to look at how we can achieve a unified patient experience. And so again, we use the moment, not just to go back to before, but say, look, it would be really helpful if we had this and this. Folks have to evacuate St. Vincent now. It would be so brilliant if they had a mobile medical record that they had consent over and access to, so that when they have to flee with nothing in their hands, they can give somebody else authority elsewhere on the next island to retrieve their medical records. When you have to leave immediately in a disaster, or an epidemic situation, somebody will often feed you and give you a place to sleep. But your medicines, You have to think about that beforehand, and it's great if you can access your. So that's an example of a lot of stuff to be done immediately. In the medium to longer term, gosh, again, building more on the universal health coverage and public health functions. I think because of our climate vulnerability, we have to look at the smart hospital program that CARFA has. Not CARFA, sorry, PAHO. We must get our health facilities resilient to face the climate challenges that are coming increasingly common. In the medium term, we have to find a way to align the climate action and investment with population health benefits. For example, leveraging built environments so that you can have more biking, walking, with greening of urban environments. Triple benefit. Bottom line, energy security is benefit human health and the climate. So finding those places are some of the medium to longer term actions in transportation, and in the more longer term, food. We have to align better the health of the people, the health of the population we want with what we're feeding them. And it's a disaster at the moment in a way, because we have an increasingly obese population with more hypertension, diabetes, cancer, and that is connected to the climate and environmental story of how we feed ourselves on the planet. So I guess, yeah, in the more medium to longer term thinking, Governor, you're on the financial side of rebalancing our societies. The focus on the complete focus on money. It doesn't matter if people suffer, it doesn't matter if the environment suffers, and being dramatic. That is not getting us where we need. That is not sustainable, and we are paying the price. We have squeezed, we put our knee on the neck of the earth, if you will, for too long. And we have to, in the medium to longer term, we have to pay attention to that. So that's a panorama of some urgent stuff around the COVID vaccination program so that we can resume normal health activities, education, travel, jobs, and some of the medium to longer term urgencies that are really connected to the fact that we live in the Caribbean and climate change is accelerating.
We've come to the end of this episode of ECCB Connects. Thanks for watching, and be sure to join us next week for another exciting program.